When our son was diagnosed with stage 4 cancer, we wanted to know everything science and experience has proven effective. What we found was a lot more than we were shown at the hospital. With so many highly educated, seasoned professionals operating outside the bounds of conventional medicine, it just didn't make sense to limit ourselves when the stakes were that high. This approach paid off, and now we're bringing the information to you. Wisdom from the top integrative and holistic cancer doctors and healers around the world, all in one place. Because you deserve true answers to cancer. It's time for a revolution against one-size-fits-all medicine, a revolution that takes us back around to the old ways of healing and forward to the new. That revolution starts right here. When it comes to reversing or preventing cancer, this is where you come for the best of the best. I'm Ryan Sternagel of the Stern Method, and this is the Anti-Cancer Revolution. Hey there, it's Ryan, and this is one of my favorite talks from our Anti-Cancer Revolution online conference series. Stick around to the end to find out how to ask these healers anything you want yourself. But in the meantime, enjoy and take something you can use right now from the show. Welcome back to the Anti-Cancer Revolution 2, everyone. I am Ryan Sternagel of the Stern Method, and in this session we have with us Dr. Jim Roach, who is America's healer. His book on patients' spiritual near-death experiences, God's House Called, was #1 in Amazon in 4 categories. His latest book, Vital Strategies in Cancer, gives groundbreaking insight on how to offer cancer care and outcomes at a level above what conventional oncology alone can achieve, as described by multi-#1 New York Times author Mark Hyman, MD. Dr. Roach leads you step by step on an all-embracing spiritual pathway to healing. From start to finish, he guides you through this important book on your journey to an enlightened understanding of cancer. Multi-New York Times #1 bestseller Jack Canfield, author of Chicken Soup for the Soul, said to Dr. Roach, "You have this amazing amount of knowledge. You are one of the most encyclopedic minds I have ever met." And I would second that for my conversations with Dr. Roach. The top integrative oncologist for the last 4 decades, Dwight McKee, MD, who is also giving an incredible presentation for this summit, calls the book the most important, practical, and comprehensive, indeed encyclopedic book to appear in the integrative cancer area that I have ever seen. In cancer, he is a published researcher, national speaker, experienced practitioner with a national clientele, and has one of the most comprehensive understandings of integrative strategies in the world. He is one of the world's leading experts in integrative medicine, #1 author in holistic medicine, national speaker, international medical consult, educator, and media communicator, researcher, and widely sought clinician, specializing in nutritional, botanical, functional, spiritual, integrative, genetic, and holistic medicine. He hosts and is chief presenter for a nationally attended practitioner integrative, holistic, and cancer conference. He is double boarded in integrative medicine, ABOIM and ABIHM. Sign up for his e-newsletter, info at themidwaycenter.com. Dr. Jim Roach, thank you so much for coming on the Anti-Cancer Revolution 2, and how are you today?
I'm great, Ryan. Thanks so much for the invitation. I'm in wonderful Kentucky. I'm outside. The birds are chirping, so life is good.
It's I'm really happy with this event. Just reading off everyone on this event's bio, I give myself a little pat on the back every time for somehow corralling all of you great folks together in one place. And it's funny, all of you great folks mention all of you other great folks just by happenstance. I don't think you really are aware that each other are on the event. And then I get the pleasure of saying, oh, that top guy that you just mentioned is also on the event, which has happened several times, people bringing you up. So it's been pretty neat getting this whole thing together. That being said, I just read your bio and all that, but and I'm really excited for this presentation. It's been one of the ones that I've been most looking forward to. But anything about yourself, more personal oriented or anything of that nature, and particularly what got you so interested in cancer, I think would be a good way to start it.
Well, I did conventional medicine for 20 years, writing more and more prescriptions to get people better. And then the last 20 years, I've done just the opposite. I've been working hard to pull patients off medicines as fast as I can, and the outcomes are much better. And I'm achieving outcomes I never conceived possible using these approaches. My father was in the cancer. He raised $70 million to build the Markey Cancer Center at the University of Kentucky. That was always his thing. But when I heard Donnie Yance speak at an integrative conference, Medicines from the Earth, Nashville, North Carolina, he was head and shoulders above everyone else I'd heard on the topic. So I went out to Ashland, Oregon and studied under Donnie, 3 different visits out there. And that was 14 years or so ago. So that set me on the road this direction. And so I've now been practicing 13, 14 years with integrative cancer. And it's just so exciting to see the results, what you can do. And, you can't always cure everyone, but you can heal everyone. And that's the most important thing that I've learned in this process.
Very good. That being said, anything about the presentation you want to get into or let folks know about before we get rolling, or is that baked into the presentation itself?
Let me summarize some of the key things that I want to address, because I'm going to be speaking very rapidly. There's a lot to cover, and I want to be sure to get these topics in. But the number one most important thing I've learned is peacefulness in cancer. And fortunately, I've had the experience. I've had 71 patients now with spiritual near-death experiences. So that has taught me a lot that, Einstein was right. E equals MC squared. We look at each other, we see solid mass. Reality, we're just energy fields. And the distance between electrons is vast. We're 99.9% hot air. So it's not that difficult for the spiritual energy field, so to speak, to separate from the physical energy field. So when the doctor's doing CPR, the spiritual energy field up above watching the whole thing. And so now I've had 2 patients with negative near-death experiences. One was an alcoholic. He had a blissful near-death experience the second time around. So I think it matters how we live our life. The reason it's important for us, why it's a key point to make today, is that they did research in mice where they implanted tumors, breast tumors in mice. They stressed one group. The group that was stressed had a 30-fold increase in metastases. And when they get law that blocks adrenaline, that prevented most of the metastases. That research is huge and reflects what I see clinically in my patients. So number one goal with all tumor patients is peacefulness. And the way I get them there at the first visit, I ask, what's your life vision? What are your passions? Are you on your spiritual pathway? Which means, are you doing what you love to do that makes the world better, that keeps a roof over your head? Are you giving love to the world? If you're not, this is a wake-up call, when you have cancer. But if you are, what my near-death patients report is the downside is ultimate bliss. If I do everything wrong, and my recommendations, if you do everything wrong, the downside is ultimate bliss. So you're going to be fine. Now, so I'm working for your family really here, not you, because they want to keep you around, but you're going to be fine regardless. The second most important point, circulation is really, really huge. When you have a cancer diagnosis, your risk for heart attack and stroke is 4 times higher. Your risk for thrombophlebitis is 10 times higher. And research has shown that 1/4 of all deaths in cancer patients is due to heart attack, stroke. So there's at least 1 chance in 4 with this diagnosis, you'll die from heart attack or stroke. And that's not often addressed by oncologists, but that's a huge stake. In my patients over the last 13, 14 years, I don't think I've had a single patient doing what we've recommended. And I've treated hundreds of patients that has had a heart attack. I haven't had a single one that's had a stroke doing what we've recommended. But I've had 3 patients. I had one who's a well-educated individual, but his wife dragged him in. He listened politely, but ignored me. A month later, he died from a heart attack. I had a cancer patient with a gastric cancer, and he had an elevated D-dimer level. I put him on Lovenox injections to thin out his blood, but then his family doctor said, oh, you might bleed to death since this is a stomach cancer. They stopped the Lovenox. 24 hours later, he had a massive stroke. I had another patient, pancreatic patient, a farmer here in the county that I lived. He didn't do anything I recommended, but he came back month after month. He developed the most horrific thrombophlebitis. He had veins like ropes up both legs. I've never seen anything comparable to that. The important thing is that that's all preventable. And not only is that all preventable, but by improving perfusion, by getting the blood adequately thinned, that helps the supplements and the chemotherapy that you're giving to get into the tumor areas where they need to get. And with chemotherapy and radiation, your risk for clotting is much higher as well. So that's the second most important point. And a comprehensive approach would be the third most important thing. But then I would like to talk some about HER2/neu and the importance of testing, assessing that, and the strategies to address that. The importance of allergies and eosinophils that would be neglected, but I think that needs to be addressed always for all of us on a daily basis. And maybe talk a little bit about P-glycoprotein inhibitors, because that can improve the outcomes as well. So those are some of the key points that I want to get to.
Very good. Yeah, it's not entirely related, but your comment about either you get physically healed or you get ultimate bliss, one or the other. It reminded me of a friend of mine who we were speaking at a conference together, and he has come back twice from stage 4. I always forget whether it's Hodgkin's or non-Hodgkin's, which one he had, but lymphoma, almost entirely naturally. I believe he did do some immunotherapy in there, but yeah, he made the comment that one day his wife kind of gave him, they were very optimistic and all that jazz, but at the same time she sat him down and more or less gave him permission to die. And his comment to that was, once she gave me permission to die, she really gave me permission to live, to really let go and just let go of that burden, I guess. And I believe that was the second time coming back from it. And this is a couple few years later, and he's he's right as rain. So yeah, it's a good perspective. Yeah.
Last week I had a patient with 3 near-death experiences, and the more those experiences, the more intuitive you are. And estrogen dominance is another really, really important topic, because 80% of estrogen dominance is successful people, healthcare practitioners, but also your patients, because we're driven, we're OCD, and we're in fight or flight day after day. So we get a lot accomplished, but we're burning the candle at both ends. And that's why we're susceptible to getting cancer. So addressing that is huge. Dr. Dwight McKee, who you mentioned that you're going to be interviewing, which that's terrific, has been trying to get stage 4 cancer patients to have near-death-like experiences. He talked with Dr. Sam Parnia, the author of Erasing Death, to try to accomplish that. With psilocybin, in Denver, I know they've decriminalized psilocybin, and I used to think, no one should do these hallucinogenic mushrooms, and I still don't recommend anyone do it on their own. But I looked up the research with psilocybin, and I'm amazed by the positive outcomes when it's done in a controlled setting with a counselor present. And it appears that at least half the time, these individuals are then able to connect spiritually to develop a knowing and a higher power. And it's just the same type of experience as you get with a near-death experience. And then you can stop worrying about dying, which allows you to relax, get out of fight or flight, and to be in a healing mode. And so I agree with that we need for all to get into that state of mind to achieve healing in cancer and to have that knowing.
Very good. Very good. Well, with that, I'll turn you loose on the presentation, and be sure to jump in if I feel anything needs clarification. But other than that, I'm excited to hear it.
Yeah. Well, my first integrative cancer patient was Ron, and he had prostate cancer. His oncologist had turned him loose. He'd given him surgery and chemotherapy and radiation, and nothing was working. And he said, "Go home to die. You have 6 months to live." And so I started Ron on my integrative protocol. I used a lot of botanicals as part of that. And initially his PSA dropped at the first month, but then it started rising inexorably. But then I was checking his vitamin D level, and I was starting him at about 3,000 units of vitamin D. I was more conservative at that time. And checked his blood level, it was 17. So I bumped him to 5,000, checked it next time, it was 17, bumped him to 10,000, 18. Every month I would bump him up. And it was only when I got him on 50,000 units of vitamin D3 daily that his blood level was normal at about 65. My target is generally 60 to 80. So that's when his PSA level started to drop. and it dropped from 225 one month to 220, and the next month to 215. And things had stabilized with him. But then he heard about a doctor in Texas. The doctor's staff told him to stop all your supplements that you're taking, and they recommended a chemotherapy which he couldn't afford. But in the 1 month's time after stopping his supplements, his PSA jumped 100 points. And by that point, the cat was kind of out of the bag, so to speak. And so that taught me how valuable, how important the whole protocol is, but particularly vitamin D as a key part of the protocol. So I think it's wise to monitor those levels and to optimize those levels. And he must have had an absorption issue as part of the problem with that. I have another patient, Cindy. I remember my sister saying to me that there's nothing to be done. She had stage 4 melanoma that was wrapped around her spine and her lungs, in her liver and her bones. And I remembered saying, well, maybe. And I don't know, I surprised myself by saying that. So I did convince her to come in. She lives 3.5 hours away, but she was eating junk food, or as Mark Hyman says, just junk. And I taught her nutrition. We put her on some key botanicals, coenzyme Q10 and chaga are a couple of the ones that can be particularly helpful with that. And then she simultaneously started interleukin-2 down at Vanderbilt. And a month later, they did a scan, and her tumor had shrunk by half. And then they repeated the scan a month after that, and it looked identical. And it turns out that was just all scar tissue. And that's why it looked identical. And so she was cured in 1 month's time in combination with what I was doing with what Vanderbilt was doing with interleukin-2. And that was reportedly the biggest turnaround in a melanoma case in Vanderbilt history. I have a patient a postmenopausal woman who had a goose egg in her breast. It was about 9 centimeters in length. And I've learned, to start an estrogen blocking drug in those individuals, because 90% of the time, at least, those are estrogen receptor positive tumors. So purposefully, I delayed her kind of biopsy and treatment for 3 weeks to give that a chance to work. By the time she arrived, I sent her to Dr. Jason Williams to do cryotherapy. By the time she arrived at Dr. Williams, it had shrunk to a diameter of 4 centimeters, which was 1/10 the original volume of the tumor. So it was much easier to do a cryoablation, that's freezing, of the tumor. And she lived, 10 years after that without any further problems. I had another patient, a 2.5 centimeter tumor that shrunk down to a little over 1 centimeter using that approach. My sister had a breast tumor, a small one. I put her on that. And by the time it was time to go in to remove it, they had a very difficult time even identifying where the tumor was. So it had worked that effectively. But I think the surgeon was mad because he couldn't find the tumor. So integrative medicine, what's its role in cancer? I really think with these types of situations that I put patients on Lotrozole, the brand name of that is Femera, 2.5 milligrams, and I start that daily. With a breast cancer diagnosis, primarily postmenopausal, but if I'm fairly certain it's estrogen receptor positive premenopausal, I might do that too. It won't be quite as effective in that setting. And I now, in the future, probably am going to add in some Ibrance on top of that, but 3 times a week. And instead of just waiting 3 or 4 weeks, I intend to wait about 8 weeks, because there's research out now that's showing even a better outcome if you do this approach for 2 months. But still, it's after you get it shrunk down, it's easier to go ahead and get that removed at that time, because it's difficult for a patient to maintain an aggressive protocol year after year after year, and you can get a more definitive treatment done. I had a patient, Terry, who had small cell lung cancer. Her husband, or ex-husband, who's a Vietnam vet, came to my back door to tell me about the case. And finally, we were able to coax her to come in to see me. And I just saw her for a single visit, but her ex-husband came back almost weekly for advice on how to manage her. And with her small cell, that's the most aggressive, perhaps, cancer that there is. And she developed large tumors of softball size on her arms. She had a large tumor behind one eye, and she had conventional chemotherapy with that. And our combination approaches were not working, but then immunotherapy was introduced. And there are specific things you can do for sure to augment, checkpoint immunotherapy treatment. And so I initiated those in combination with their immunotherapy drugs. But also, again, I was counseling her through this process. When she was getting chemotherapy, they were offering her snacks, and her, ex-fed husband said, "Don't you give her that poison." And then the patient in the next chemotherapy chair said, "Don't you give me that poison either." He was kind of starting a revolution there in the chemotherapy suite. And then when they tried to put her on steroids for side effects from the immunotherapy, he asked me, and I said, no steroids. That's going to suppress her immune system too much. They tried to get her started on Neupogen when her blood counts were dropping, but those types of drugs just put immature cells out in the bloodstream. So it makes the blood counts look a little prettier, but really doesn't improve the situation much at all. There are other better strategies for boosting red blood cells, in the week prior to chemotherapy to help protect against having to stop chemotherapy due to low hemoglobin hematocrit, white cells, or platelets with that.
I would jump in on the Neupogen note. They tried to give my son that when he was diagnosed with neuroblastoma, and I found research on it aggravating existing neuroblastoma cells, making them more aggressive. So that was a big no for us.
Yeah, I would definitely. It's not necessary, I think, is the bottom line. There are other strategies that usually will work. So, in the week leading up to chemotherapy, that's a time where you can actually use some botanical supplements that are a little bit anabolic that normally might speed up tumor growth. But that's okay because, number one, you're strengthening the patient to help them withstand chemotherapy. And number two, chemotherapy is more effective going after rapidly multiplying cells. So as you actually speed up the tumor growth, the chemotherapy is going to work more effectively. But it helps maintain hemoglobin hematocrit. Astragalus, for example, would be one in that category. I use a product called Immucare as well that has a combination of products that help maintain that. So I think that's an important point to make. So anyway, with Terry, the immunotherapy in combination with what I was doing actually worked with her. She did get radiation to shrink the tumor behind her eye. But a year ago, they did chest x-ray and they said, well, it still looks like there's tumor present. But my blood work that I was doing all looked terrific with her. And she had her repeat chest x-ray and it looked identical. And it's just like Cindy, the melanoma patient. This is just scar tissue. A year later, the chest x-ray looks identical. The oncologists hadn't figured that out. They've never seen a small cell lung cancer be cured. So they're still referring this patient to hospice and still pushing opioids and so forth, but she's having no symptoms and her x-ray completely stable. So I mentioned her in my book, another fascinating case. I got interested in cancer partly when my PSA went to 12.5. My father had prostate cancer, and the first recommendation was to take off his genitals. It's kind of an unusual prostate cancer, but fortunately got second opinion about that, and they didn't have to do that, and he was the second person to be cured with this particular type of prostate cancer. So when my PSA went to 12.5, I kind of panicked with that. So I optimized my nutrition, started doing daily fresh smoothies, got on optimal botanical program, and gradually that PSA over a 6-month period gradually declined down to 2. Now, was it a prostatitis? Maybe, but I wasn't going to take any chances with that. And so it taught me, and I felt God in that situation was teaching me, this is what prostate cancer feels like, so that I can advise my new prostate cancer patients to get them in that peaceful spiritual place right away in that process. Because with that panic, you feel like you're blinded, you feel like you've gone deaf, like a deer in the headlights in that situation. At the initial visit with my cancer patients, there are a number of things that need to be addressed. Number one, life vision, spirituality. Number two, nutrition. Number three, exercise. May be more important than chemotherapy with breast cancer, with colon cancer, with other prostate cancer even. Sleep, we can optimize sleep. So often restless sleep can be an issue. Relationships, we need to encourage patients to build relationships, but at the same time, they need to get negative energy out of their life. And if the oncologist is negative energy, they need to fire the oncologist and go a different direction with that. With biopsy, even before you do the first biopsy, if it's a female premenopausal, you want to get estrogen levels as low as possible to protect against metastasis. So you don't want to do biopsy on day 14 of the menstrual cycle when estrogen levels are high. You want to wait till the menses or a few days after that, and then use some strategies to block estrogen along with that. I counsel patients about chemotherapy and radiation at that first visit if I can, and then nutrients to promote peacefulness, to promote circulation, to strengthen the immune system. And I do comprehensive blood work that I'll get into here in a little bit later. And I like to mention that this is an opportunity for the patient to reinvent themselves, a time for metamorphosis, because nobody's going to say anything about what their new personality or how they're dressing or their new name for themselves, because they have cancer, right? Who's going to say anything negative to someone diagnosed with cancer? That first week after you're diagnosed with cancer, the risk of suicide 12.6-fold higher, and the risk of heart attack 5.6-fold higher. Research out of New England Journal of Medicine. So getting them grounded spiritually is really key. Getting that circulation fixed immediately at that first visit, getting them on bromelain is a key systemic enzyme given between meals, that is empty stomach, is a key one that I use to help get the blood thinned initially while I'm waiting that D-dimer result. Fish oil helps in that process. Vitamin D lowers fibrinogen. Turmeric is another one that helps thin out the blood, a really key thing. And then, the heart energy field reaches out 15 feet. And so when I'm with a patient, it's important for me to not having negative thoughts with that, because that's transmitted subconsciously to the patient. So I need to go into that meeting with confidence and with a positive energy to transmit to the patient. And I'd always strive to say a prayer before I walk into the room. The art of healing really reigns supreme. And then again, I ask, what's your life vision? What are your passions? I share about near-death experiences, share about the alcoholic, and then I teach about forgiveness. So often, and this is really key, estrogen dominance is so important to understand. Again, 80% of us are estrogen dominant because we eat too many processed foods, because we are exposed to xenoestrogens like BPA in plastic bottles, because we're bigger, many of us, than our ancestors. In fat cells, we convert testosterone to estrogen. And so that's part of the mechanism of having high estrogen levels. But we also have gene mutations, COMT, CYP1B1, CBS gene mutations, and MTHFR, where we have an impaired ability to get rid of estrogen. And two of those, COMT and CBS, are associated with, if we have mutations there, with the COMT, we can't break down adrenaline. So whenever adrenaline kicks in, it kicks in harder. With CBS, we have B6 deficiency and therefore can't convert glutamate, which is an excitotoxin, into the calming, relaxing GABA. So those are two common scenarios where high estrogen is tied in with overstimulation. So estrogen dominant individuals, males and females as well, anxiety, panic, obsessiveness, phobia, sleep disturbance, irritability, carbohydrate cravings, swelling, breast soreness, tenderness, migraines, heavier periods, cramping, bloating, brain fog, aches and pains in joints and muscles. And many women will recognize those as premenstrual symptoms, which they are, because if you're stressed and you don't ovulate, you don't produce the calming, relaxing, neutralizing progesterone and have just that overstimulating estrogen. So it's key to address that, and tied in with that higher estrogen, the way the liver responds to that is producing sex hormone binding globulin, which not only binds up estrogen to reduce the amount in the bloodstream to just a certain amount, but it binds up testosterone and binds up thyroid hormones, so available thyroid and testosterone levels drop. Testosterone gives you courage, confidence, motivation. It's anabolic to the immune system, to have a strong immune system. It impacts libido, of course. And so we need to get estrogen levels down and testosterone not high, but back to normal. And that's what vitamin D does. That's what zinc does. And the opposite of zinc is copper. Copper, by suppressing zinc, promotes estrogen and dihydrotestosterone. So I want copper as low as possible in my cancer patients. It's in nuts, avocados, dark chocolate. So avocados have some good things in them as well. So I don't say eliminate avocados, but maybe 2 or 3 times a week, if you eat an avocado, take an extra zinc to neutralize the copper in there. But maybe eliminate nuts or just once or twice a week. And incidentally, if you have prostate issues and you want to get up extra times during the night, just eat nuts, because nuts are guaranteed to get you up more at night. They'll swell that prostate and lead to diminished urination, more frequent urination. But forgiveness, it's these estrogen dominant individuals that have been in fight or flight every single day their whole life. They don't know what peacefulness is. They've not experienced peacefulness for 24 hours when they're COMT plus plus, that is a homozygous mutation with the COMT mutation. When they're CBS plus plus, homozygous on that mutation, they don't know what peacefulness is. And so being estrogen dominant growing up, that attracts negative energy in your life. And when that negative energy arrives, you experience trauma with that, and your adrenaline kicks in and you can't metabolize it because you got that COMT gene mutation, right? That's PTSD when you get that. And so you harbor that with you for, not only for years, but for decades with that. And so the religion I'm a part of, forgiveness isn't an option. In order to be forgiven, we're required to forgive. First of all, ourselves, and maybe you've been rich and everything's gone perfectly, but probably not. But forgive others, not because they deserve it, but because we have to get rid of that yoke of unforgiveness for us to heal, for us to live in the present. So that's a critical thing really to address at that first visit, and that usually is an issue and a problem. And if you don't address those key psychiatric, spiritual issues, then it makes healing much more difficult. There's a good book for individuals that experienced a lot of abuse called Waking Up in Heaven by Crystal McVeigh. I have no financial connections, but she was abused in so many different ways, and she was able to get to the other side, partly through a good spiritual experience. Now, when you're diagnosed with cancer, it's not a medical emergency. It's a time for study and research. There are a few types of cancer. Small cell lung cancer, you need to be a little bit more aggressive with it, and one or two others. But generally, you have time, particularly if you get on a good protocol of botanicals and other things under a good integrated practitioner, functional medicine practitioner, then you have, that buys you a month or so to research and identify what are truly the best things to do. From a nutritional perspective, I'm starting to look some at doing intermittent fasting. I think it depends on the patient. Certainly time-restricted fasting, I think we're finding is a worthwhile thing because it limits the amount of insulin our bodies produce. Insulin is anabolic, promotes tumor activity. So probably for all of us, limiting eating to 10 hours a day. But with some patients that aren't too hyper, that are burning through their calories very quickly, maybe 2 days a week, they could just eat one meal on those days in the middle of the day, because if you eat late in the day, that's more insulin. But if you could strict eating to maybe 12 to 2 in the afternoon, 2 days a week, and fast the rest of the time, and don't take supplements or prescriptions during that fasting period in the morning, because that'll crash your blood sugar. But that's an approach that I think is going to be helpful for my patients, and it's something I'm doing personally as well. There's a case report of, this was in a book by J.C. Pierce called Cracking the Cosmic Egg. Mr. Pierce's wife had failed all breast cancer interventions. She'd had surgery, chemotherapy, radiation, was sent home to die. And so she fasted for 11 days and then 10 more days after that. And her husband read stories of positive energy healing continuously to her while she was awake and asleep during that time. And after 3 weeks, she was healed from that. Fascinating story about that. Certainly fasting, very important in at least the 24 hours before and the 24 hours after chemotherapy. Why is that important beforehand? Well, your healthy cells are used to a fasting state. It's in our genes. We all, through our ancestry, had to have periods of fasting to survive. So the healthy cells have an off switch. They stop multiplying. But tumor cells don't have an off switch. They continue to multiply. And that way, when you get chemotherapy, it just goes after the tumor cells and not nearly so much after your healthy cells. So that reduces side effects, generally speaking, by half across the board. Side effects like nausea and diarrhea and abdominal discomfort and skin-related issues as well. And then why would you fast after chemotherapy? Well, some of the tumor cells died. Other tumor cells are halfway dead. And the ones that are halfway dead, if you eat, like having a snack during chemotherapy, the half-dead tumor cells say, well, thank you. I was almost dead and you fed me and helped me survive. So if you can go another 24 hours, those halfway dead tumor cells can go ahead and die. So you can see improved outcomes as a result of the chemotherapy with that. Now, maybe not everyone is able to do water fast for 48 hours continuously. You may be able to do 2 tablespoons of coconut oil 4 times a day, the day before and day after. That can help keep your blood sugar stabilized. But again, during the fasting, you don't do supplements or medicines. Now, when you're doing the 1 day, 1 meal fasting, you can do supplements like 30 minutes before the meal and during the meal, and still do nighttime things to help you rest at night if necessary, but just kind of limit supplements. And that's a way for patients to save money as well. With nutrition, I initially want patients on a vegetarian, diverse, organic, whole food, non-GMO type of diet. I like healthy fats, coconut oil, olive oil, fish oil. I encourage them to drink water and green tea, maybe other herbal teas, but not anything else, certainly not juice because of sugar. We avoid cow's milk products because 95% of my patients are sensitive to cow's milk products. But if your patient likes bloating, if they like flatulence, if they like to have postnasal drip, then by all means, encourage them to drink milk and eat cheese, so forth. But others in the room will probably want to disperse because of the flatulence associated with that. So cow's milk products also have casein, and casein is tumor promoting. So if you want to do a dairy product, maybe goat yogurt has half the casein, and goat yogurt has lysine in it. And actually, the yogurts have the most lysine of all. Lysine protects the interlacing between cells to strengthen cells, protect against invasiveness. And I do encourage patients to avoid grains because I think they're inflammatory and they end up around the waist. Eventually, down the road, when they get stabilized, I can revisit that issue. The Seventh-day Adventists looked at nutrition, and for example, red meat certainly is a concern. Red meat has iron in it. Tumors love iron. They feed off that iron. And further, if it's not organic red meat, 95% of all toxins are stored in the fat in red meat. And it's marbled in, so it's difficult to cut all of that out. So there's certainly a strong correlation with red meat and cancer. The correlation with white meat is much less. So the book, Diet, Life Expectancy, and Chronic Disease, is a good one to look at to see the connections that with regards to Seventh-day Adventists and cancer. So green tea is a great hormone modulator. It blocks testosterone to estrogen. It blocks testosterone to dihydrotestosterone. DHT, dihydrotestosterone, is 5 to 10 times stronger than testosterone. And obviously, if you have a prostate cancer, you want to be avoiding DHT. So green tea helps modulate that in a favorable way. The L-theanine there helps keep you in a calm, relaxed state as well. So lots of research with green tea, and especially the EG-CG content, the catechins. So strongly recommend that for all patients. There are many different foods that are beneficial, certainly the cruciferous vegetables, broccoli, cabbage, kale, and so forth, particularly broccoli sprouts, maybe 100 times more potent than broccoli. Watercress, particularly good. And that onions and garlic, a lot of positive research for prevention of cancer with onions. And, that has sulfur in it to generate glutathione for detoxification and to dampen inflammation. Mushrooms are wonderful, but always cook them. Have some toxins in them. But mushrooms do what? They boost testosterone, they block estrogen, and that's almost always helpful. And many other good things. Ellagic acid, which is in cranberries and strawberries. And so generally we're cautious about fruits, but there are some fruits that I'm okay with using. Berries, particularly blueberries, are favorable. They actually have favorable hormonal modulating effects. Tart apples have quercetin in them, so Granny Smith or Honeycrisp apples And if you're doing a smoothie, you can get a whole lemon or lime, an organic one, and just put the whole thing in with the peeling. The peeling has limonene in it, which is also another good hormone modulator. So those are other key nutritional things to consider with that. Um, but we all have food sensitivities thanks to antibiotic therapy. We've all had antibiotic at one point in our life, just about, and that weakened our intestinal tract and that diminished our microbiome and led for all of us to have food sensitivities. So identifying those as quickly as we can, either through testing or through food elimination, uh, is key, because when we eat those foods, it's generating inflammation that weakens the intestinal lining that allows toxins to cross into our system. You know, the bacteria in our intestinal tract are like um, dogs and cats. They eat food and they excrete toxins. Normally those go out the bottom, but with increased permeability, those toxins get in our bloodstream. They particularly are lipophilic. That means they go to fatty places like the brain, nerve sheaths, and in women to their breasts. So um, it's key to avoid those foods. The whole digestive process is important. So when you sit down for a meal, you need to be completely relaxed. Remember, your heart energy field reaches out 15 feet. If anyone at the table is anxious, then everyone's going to be in fight or flight and out of digestive parasympathetic mode. That's one reason you say your prayer before a meal, to switch you into parasympathetic mode. You chew your food to liquid. You want to use bitters. Anything that tastes bitter is a bitter, you know, like apple cider vinegar or black cumin seed oil. Ancient panacea that was in King Tut's tomb. It's mentioned in the Bible twice. It has a lot of anti-tumor research associated with it. So that's one I use quite a bit with my patients. And personally, I take ginger. Ginger, you know, these bitters stimulate saliva acid digestive enzymes in bile. But in addition, ginger promotes stomach motility, protect against acid reflux. It has a number of anti-tumor properties. It's anti-inflammatory. That's another good one to use as a bitter. And then digestive enzymes further break down those food proteins into harmless amino acids. Okay, and therefore they're not hypersensitive when that happens. But you can't break down gluten, which is one reason that I avoid that. So we need to heal the increased intestinal permeability, and that's where probiotic comes into play. I often use marshmallow root. You know, marshmallows used to have marshmallow root in them. Now they're just pure sugar, but you understand the mucilaginous nature of the marshmallow root to kind of coat and soothe the intestinal lining. So if you ever get abdominal discomfort, marshmallow root generally always will help with that. And it's very benign to use. Um, so those are the key strategies. You know, get off alcohol. You know, some people might say, well, wine would be good because it has resveratrol. Well, there are 100,000 molecules of alcohol for every molecule of resveratrol in wine. So don't use that excuse. Wine is just sugar in a lot of ways. Alcohol is toxic to the liver, meaning in the liver is where you metabolize estrogen, so you're going to end up with higher estrogen. Now, guys, if you like to have big breasts and you like high-pitched voice, then go for the alcohol, no problem. But if you like testosterone like I do, you may want to skip your alcohol consumption. And when you're consuming alcohol, you're going to wake up in the middle of the night going through alcohol withdrawal and won't be able to get back to sleep. I like to sleep at night. So I mentioned that I wanted to talk about allergies in cancer because allergies promote inflammation and inflammation angiogenesis. And so we all have, I think, sensitivities, as I mentioned. So I think all of us ought to be on natural anti-allergy treatments, not prescription ones, because prescription ones are anticholinergic. What does that mean? Well, acetylcholine is the memory neurotransmitter. So whenever you take an anticholinergic drug, there's 75 of those out there, you automatically have brain fog and you're automatically on the road to dementia. That's proven now in research. But also acetylcholine is the neurotransmitter for the parasympathetic nervous system, for the vagus nerve. So in order to generate saliva, acid, digestive enzymes, and bile to break down those food proteins to free up nutrients, you need that acetylcholine. But if you're on Zyrtec or any other antihistamine, or if you're on Bentyl for intestinal cramps, if you're on Ditropan for urinary incontinence, if you're on Atrovent for your asthma, if you're on Zantac, if you're on SSRI antidepressants, all of those have anticholinergic properties too. And so you really want to get away from that. So what you want to use instead, boswellia, frankincense, doesn't seem to hurt Jesus too much. That promotes learning and memory, and Rhodes promotes branching of brain cells, right? That's what I would prefer to use rather than something that promotes dementia. It's anti-yeast biofilm, promotes healing in the intestinal lining, and anti-inflammatory to joints and to arteries, and has a lot of anti-tumor research with it. But it's a good natural anti-allergy agent. It's also has anti-asthmatic benefits associated with it. Another one that is as good or better is quercetin. I mentioned that earlier. It's a bioflavonoid in apples, onions, broccoli, and blueberries, and has many different identified anti-tumor properties associated with it, but it's terrific in addressing allergies, and even it's helpful with asthma. So I probably in the future, I'm going to be putting all of my patients just on a specific quercetin product in combination with bromelain, which improves absorption of that product. And so the bromelain has other benefits. Remember, it helps thin out the blood if you take it on an empty stomach. And if you take it with food, it has zero benefit for thinning out the blood. When you do a blood count, a CBC, check the eosinophils. That's the marker for allergies. So you want the eosinophils to be 1% or less, but very often they're higher than that. And when that's the case, you want to especially emphasize those healthy anti-tumor, anti-allergy approaches with that. Incidentally, if you eat leftovers, the longer food sits around, the higher the histamine content. So you want to really be eating all your food fresh, prepared fresh every single day. Because if you wait a day, more histamines. If you wait 2 days, lots more histamines. That's going to promote inflammation. And that's going to worsen your prognosis when you do that. Of course, glyphosate, Roundup is a concern. All of us have Roundup in our system now. Whenever you go out to eat, if it's not organic, you're getting Roundup. Roundup kills off the lactobacilli. That's almost half of our intestinal microbiome when we ingest Roundup. And it also has an estrogenic type of effect. It triggers oxalates in the intestinal tract. Oxalates are huge. Let me repeat that. Oxalates are huge. I personally experienced that because I had plantar fasciitis for 9 months. I couldn't figure out why. It was because I was eating a spinach smoothie on a daily basis, right? Spinach is healthy. Everyone knows that. Well, not necessarily. It's loaded with oxalates, 3 times the oxalates in spinach than any other food. So I now recommend for all my patients, cancer or otherwise, to limit their spinach to like 14 leaves per week because of the oxalate content. A lot of other foods have oxalates in higher quantities. Nuts, green tea even has some oxalates in it. Too many berries can get you into trouble with that. Swiss chards particularly can be a problem. So, but other greens are fine. You know, kale, arugula, romaine, those greens are fine. But initially, it probably would be best to eliminate spinach entirely for the first month after you're diagnosed. Oxalates are most famous for kidney stones. 80–90% of kidney stones are calcium oxalate stones, but it turns out oxalates are in all the tissues of our bodies, in our joints and muscles, causing discomfort. On breast tumor biopsies, malignant tissues always have more oxalates than benign tissues do, and it's been demonstrated that oxalates are clearly cancer promoting. And part of that is that oxalates are metabolized by the CBS transsulfuration pathway. Now, those are big words. Let me break that down. The pathway from homocysteine down to cysteine to glutathione is called the transsulfuration pathway. CBS is the gene that programs for the enzyme for that pathway to work. The cofactor to make that pathway work is vitamin B6. This is important. Remember this. Vitamin B6 is necessary. So if you eat too many oxalates, guess what? You burn through all your vitamin B6 and become B6 deficient. Why is that important? Well, that pathway is a pathway for detoxification, to get rid of toxins, heavy metals, and to get rid of estrogen metabolites. It's also a pathway that generates coenzyme Q10 and taurine. So those are very important for our health. CoQ10 for mitochondria, and taurine is an important antioxidant, particularly for the cardiovascular system. But B6 also is the #1 cofactor for converting glutamate to GABA to get it into a peaceful state. So if you're eating too much spinach, guess what? You're going to be more anxious because you're not able to convert glutamate into the calming, relaxing GABA. And glutamate's been demonstrated to clearly promote tumor activity in the body. So how do you know whether you have enough vitamin B6? It is very, very simple. I ask my patients the first visit, how many nights a week do you remember your dreams? I want my patients remembering their dreams every single night. Why? Because that CBS pathway is the dream pathway, okay? B6 is the dream vitamin. Now, can you just give vitamin B6? No, not really, because there are at least 7 nutrients: vitamins B1, B2, B3, biotin, magnesium, zinc, lysine, and maybe others are needed to convert B6 into the activated form, pyridoxine 5-phosphate. So it's much better to give pyridoxine 5-phosphate, P5P. You can get a 50 milligram strength on that. And I give it to my patients with supper. And every 2 nights, I have them increase the dose up to 200 milligrams. Now, sometimes it can cause dreams that are too vivid, then you back down on the dose. 85% of the time, that gets patients dreaming every night. Now, if you're obese, you may need to go up to 300 milligrams with the dosing. And 85% of the time, I find it gets patients more relaxed, where they're able to sleep better because it's converting glutamate to GABA. So there's a lot of research with B6 and P5P, both in prevention of tumors, but also in management of tumors. That's especially important with brain cancer, but also with any estrogenic cancer, obviously, in terms of its impact on getting rid of estrogen metabolite. So be sure you're dreaming every night, and be sure your patients are dreaming every night, and ask that question at the first visit. So a key takeaway from what we have to share with you today. And you can get oxalates tested. You can have it tested through, there are at least a couple of different labs that do organic testing that can assess oxalate status. You could even, through a regular lab, it's not as accurate always, and you can't rely on that, but you could do a spot urine, a creatinine to oxalate ratio to see, and if the oxalates come back elevated on that, then you know you have a problem. If it's not elevated, that doesn't rule out issues with that. So it's important to get lean and fit. So, target an ideal weight and physical fitness. I grew up in the 60s. John F. Kennedy was insisting that all of us get an optimal physical condition to get exercise. And research has clearly shown, as I mentioned, with several different tumors, that exercise may be more effective than getting chemotherapy. And so it's fine to walk, but I'm not talking about walk your dog pace of walking. I'm talking about walking at a rate where you can get 1 sentence out, but not 2 sentences out, and target 45 minutes to an hour a day at least of that. Now, of course, gardening and other forms of physical activity are also wonderful to be doing. What you do not want to be doing, though, is you don't want to be training for marathons or running marathons, right? Exercise is good up to a point, but beyond a certain point, then it becomes inflammatory, and then inflammation promotes angiogenesis. So I'd had a triple negative breast cancer patient who was stable, was doing well, but then she started training for a mini marathon, and boom, her inflammation kicked in. And with triple negative, that's the worst thing that can happen is inflammation. And she deteriorated kind of rapidly after that. So appropriate balance is key there. Sleep, very, very important. If you don't get sleep, for one thing, it causes weight gain. So if you can't lose weight, it may be because you're not sleeping. But it impacts natural killer cells. It affects your ability to detoxify. Research has shown it impacts breast cancer recurrence and evolution into more aggressive breast cancers, but also prostate cancer risk with that. So what are some things that you can look at to safely support sleep? Well, P5P that I just mentioned, the active form of vitamin B6. Number 2, melatonin. Melatonin, strongest antioxidant, but it helps get rid of excess estrogen as well. So it has a short half-life, so you could take some at bedtime, and then if it wears off in 3 or 4 hours, you can pop another melatonin if you can get lozenges, or you don't have to drink extra water. Something that I put essentially all of my patients on is inositol IP6. Inositol is vitamin B8. And it's calming, relaxing. Research with 4,000 milligrams every 8 hours demonstrated that it was as effective for anxious depression as giving an SSRI antidepressant. But also it dampens estrogen levels, it dampens dihydrotestosterone. So there's research in terms of prevention of cancer as well as in management of cancer. And again, it promotes peacefulness, which I've emphasized is the single most important thing that we need to achieve with that. So I started like 1,000 milligrams of inositol, and I used that inositol IP6 form because that is the one that has the research behind it in cancer. 1,000 milligrams every 8 hours. And then after a few days, you can go to 2,000 every 8 hours, 3,000, up to 4,000, and potentially even higher. With that, titrate that up until you're at peace 24/7. Whatever dose achieves that is the dose that I want my patients on. Chrysin, derived from passion flower, is a terrific, it's the most potent aromatase inhibitor. Aromatase is the enzyme that converts testosterone to estrogen. So chrysin, maybe more than anything else, naturally blocks that, but it also is calming, relaxing. So it certainly can have anti-tumor activity as well as helping you sleep at night. I personally take 3 chrysin every night because I like my testosterone and I don't like estrogen. And remember, healthcare practitioners are estrogen dominant, and I'm no exception to that. I need to bring that estrogen down and optimize testosterone. Magnolia with Hanakyle is calm and relaxing. Hanakyle in bigger doses has been compared to Valium, for example, and has a number of anti-tumor properties associated with it. And incidentally, it's anti-HER2/neu. So particularly in patients with HER2/neu issues, and I monitor HER2/neu in most of my cancers. 70% of all cancers have HER2/neu involvement. And when HER2/neu kicks in, that promotes invasiveness and risk for metastasis. So I check HER2/neu levels initially every month in the types of tumors that are particularly prone to getting into HER2/neu issues. And one of the things I address it with is Magnolia with Hanakyle. Chamomile tea is another one. Calming, relaxing, helps sleep, anti-HER2/neu, and particularly for gastrointestinal cancers, teas are particularly helpful there. Epsom salt baths, detoxifying. You get some magnesium that's calming, relaxing. And it's with magnesium, I'm a little cautious, but getting magnesium through Epsom salt baths, you're fine. If you have to have magnesium, use magnesium taurate, Taurate, because that taurine has a lot of demonstrated anti-tumor research associated with it. And then there are others beyond that that can help with sleep. But of course, you need to get that exercise to help get rid of that adrenaline naturally to also help you sleep. You need to practice good sleep hygiene, and don't take your cell phone into the bedroom with you, right? It needs to be pitch dark. All those common sense things. You need to get rid of electromagnetic fields. Don't have your head close to the walls, because walls have wires going through them usually, and that generates electromagnetic fields. So keep your head at least 4 feet from the walls, and particularly from electrical outlets with that. Strong relationships, very important. It's important to smoking and obesity and addressing that. Having someone to advocate for you. So, when you're seeing the oncologist, have a list of questions you're going to ask, but don't ask those yourself. If you're the cancer patient, get your advocate to ask those questions. So the oncologist often is more respectful to your advocate who's with you than they would be to you. But that's key, to always have an advocate to help you when interacting with a healthcare practitioner. There are a number of cautions with cancer. I mentioned about steroids. If you have melanoma, don't use hydrocortisone cream on your arm, because just that little cortisone can cause melanoma to bloom. Obviously, you want to be careful about inflammatory sources like root canals. You want to be cognizant of mercury amalgams in the teeth. Don't do anything to aggravate those. You want to minimize x-rays. So if you get blood work done regularly, you can have a pretty good handle on how this tumor status is doing, and probably reduce by half the number of CAT scans and MRI scans that you might have. Mold is huge. You've got to eliminate mold. And just today, I had a patient, we tested C4A in the blood, which is a surrogate marker for mold, and it came back 4 times the upper limit of normal. I had an ADHD dyslexia kid, developed behavioral issues, was writing backwards, and it had begun suddenly after they'd moved in, the family moved into this house. And so I found that his C4A marker was elevated. I called him and said, get out of the house as quickly as you can. And his behavioral issues resolved within 30 days. Instead of writing backwards, he was writing frontwards again. There was an MS patient that I heard about just recently who, when they got rid of the mold, that was maybe the biggest factor for improving their multiple sclerosis. So obviously it increases inflammation. It's a source of major toxicity. I mean, these are bad toxins. So you want to eliminate mold in your house and your work, and do everything to heal your leaky gut associated with that. And electromagnetic fields, you don't want to be within a mile of a cell tower. Within your house, you might want to measure EMFs. You can get an EMF meter, maybe through Radio Shack online, for about $99. Go through your house, identify the hot spots for EMF if you need to do that, and turn off your wireless internet whenever you're not using your computer, and certainly overnight, because those EMFs increase intestinal permeability and they increase blood-brain barrier permeability, so you have more toxins in your system and especially in your brain with that. And another reason not to have your cell phones right in your bedroom, and certainly don't put them up to your head. With biopsies, it's really key to try to ideally get on a good support program before you even get the biopsy done. I talked about minimizing estrogen. That's a key thing. But if you can get on some other good botanicals like turmeric, be sure you're on full doses of vitamin D and so forth to optimize conditions, because biopsies, maybe as often as half the time, can trigger metastases. And so you want to do everything you can to protect against that. And probably even prescription drugs like Celebrex, or if you can't get Celebrex, Aleve over the counter, or even aspirin, may protect against metastasis from biopsy. Also, the drug propranolol, if you don't have asthma. Now, don't take it if you have asthma, it can kill you. But if you don't have bronchospasm, then propranolol, right before, say a day or two before, and certainly a few days after, very likely will protect against metastasis risk tied in with just a biopsy. And the same thing with surgery. Both those drugs are protective against metastasis that can develop from having surgery done. So get your physician to prescribe those for you. Then, if you have a big tumor, say you have a big tumor in your abdomen, should you have surgery to get that out? You're probably not going to be able to cure it by removing the tumor. So should you really have the tumor removed? Well, remember that tumors are not homogeneous, they're heterogeneous. So each tumor cell is kind of a cousin of the other one, right? So some tumor cells have different markers than others do. So if you have a great big mass, that's a lot of diversity of tumor markers that's very difficult to give enough botanicals and chemotherapy and so forth to hit all those different markers. So if you debulk the tumor, take out the large amount of the tumor mass, then that's going to substantially reduce the diversity of those markers and make your other approaches healthier. So certainly debulking of tumors can be beneficial in that type of scenario. And getting tissue evaluation, as many of you have already heard, if you can specify which treatments are best for your particular tumor by getting tissue markers, then you want to do that. Neogenomics is the company that may do the best job to consider in assessing tumor markers. And of course, Dr. Nagorny, Dr. Weisenthal out in California, if you can get a fresh tumor specimen at the time of surgery, you send it off to them for about $3,000, $4,000, then they can grow that with chemotherapy drugs, and that's produced better outcomes. And there are a number of books that talk about that as well. So if you have breast implants, and if you have breast cancer and have your breast removed, don't get a breast implant, because that's going to trigger inflammation. Most of the time, that's going to lead to autoimmune issues. And if you get a breast implant, it's hardly ever it's going to be perfect in its appearance. You may get an abnormal appearance and then later develop scarring. And then that's double the inflammation, double the wound. Because, when you have one breast removed, that creates quite a wound, and that sends out cells to grow blood vessels to heal that. But the tumor cells, any metastatic cells, may get that same message to grow tumor cells. And so you've got to be cognizant of that. If you have two mastectomies, it's going to create greater risk for metastasis with that. So cancer stem cells, we've learned that tumors produce cancer stem cells, and that's why so often the chemotherapy and radiation are not going to fix the issues, because those go after the rapidly multiplying cells, but the cancer stem cells are just sitting in the background. So the chemotherapy and radiation usually don't hit those cancer stem cells. So it appears that the chemotherapy is working because the tumor is shrinking, but not those stem cells. Those are still there. And so that's why you can't rely on those treatments by themselves to address that. And interestingly, there are a lot of different nutrients and botanicals that you can give to help address cancer stem cells. And so as a bonus gift, I'll be happy to offer a list of over 100 natural nutrients that can help do that. But I'll go ahead and mention maybe two or three that would help with that. For example, green tea would be in that category. Certainly turmeric would be in that category. Sulforaphane, which is derived from cruciferous vegetables, would fall into that category as well. Leptin, adiponectin. Yeah, leptin's a great thing to check right at the onset of tumor, because if you have a high leptin level, that really promotes estrogen dominance. And again, estrogen promotes inflammation, angiogenesis with that. And there are some significant ways to bring leptin levels down. It's particularly present, of course, it's produced by fat cells. So the more fat cells you have, the higher your leptin's going to be. And kind of the opposite of leptin is adiponectin. So you want adiponectin as high as you can and leptin as low as you can. And there's some good strategies to help address that. Now, incidentally, I put a lot of my patients on the injection Lovenox for circulation. All my pancreatic cancer patients, I immediately put them on injectable heparin in the form of Lovenox, which is a long-acting heparin. And that actually has some anti-tumor properties, and heparin is one of the things that hits cancer stem cells. So another reason that you would want to consider being aggressive. And I'll get to this in a minute, but when I check D-dimer level, I think if it's above 2, I had been using a cutoff of 4, but I'm going to get more aggressive. If I have a D-dimer level above 2, I'm going to try to get the patient started on injectable Lovenox. Just with an insulin needle, insulin syringe, you can inject this in the subcutaneous tissue in the abdomen once a day. And I know that was maybe the most important factor that I did with a pancreatic cancer patient that I had. He was an older gentleman, very nice fellow, had a lot of great stories to share with me. And I put him on Lovenox in our protocol, and he felt better, with his pancreatic cancer than he'd felt in years on the botanical approach with the Lovenox. And for, golly, 8-10 months, he did beautifully with that before things started kicking back in. Many of us are familiar with Dr. Nick Gonzalez, who is now deceased, but in New York City, Dr. Gonzalez may have had the most success with pancreatic cancer of any doctor in the country. He claimed a 5-year survival of 35%. What was his approach? Systemic enzymes were probably the most important thing that he did. He would give large volumes of, he would give, like I mentioned bromelain, he used pancreatic enzymes that had trypsin, chymotrypsin in it, and there's some products on the market that have those in it for that purpose. He would maybe give 12 or 14 of these enzyme products between meals, and would give maybe like 10 of those during meals. And that was a big part of his success. But what does that do? That thins out the blood, and it cleans up all the gunk in the blood to allow improved perfusion so your immune system can work more effectively, but also botanicals or even chemotherapy that you use to get to where they're needed more effectively. Because all of these have research behind them, maybe the WNT pathway or EMT pathways, so specific pathways that are associated with circulating tumor cell metastasis. So in my new patients, I check a whole list of things. Let me tell you what tests I like to focus on. With a CBC, I want to focus on the platelets. Number one, because platelets have growth factors. So if platelets land on a tumor site, they're going to promote tumor growth. Plus, they thicken the blood. So you want to keep platelet counts on the lower end. You want to keep those stable. If you see those rising time after time, it suggests that the tumor is becoming more aggressive and you need to get more aggressive in your modulation. I look at the neutrophil lymphocyte ratio. The higher the neutrophils, the more inflammation you have, and the corollary is that lowers the lymphocytes. So we like to keep that level stable at a ratio of 2 to 1 neutrophil lymphocyte or lower. And then I mentioned the eosinophils a little earlier. On a chemistry profile, we look at blood sugar, we look at albumin. We want albumin at 4.5. or higher because your immune system needs those proteins. We look at liver enzymes as well. And, with liver metastases or elevated liver enzymes, there's some very simple things that are surprisingly effective. Artemisian, for example, is something that I find is particularly helpful in management of tumor issues. So I use products that include that, and a lot of the liver detox supplements, the mushrooms like reishi, can play, and turkey tail can play an important role in dealing with any type of liver issue. So I don't worry about liver metastases because they usually respond nicely to treatment. So I look at C-reactive protein as an inflammatory marker. Ceruloplasmin is a storage form of copper, just like ferritin is for iron. So I like to keep ceruloplasmin less than 25. And copper, as I mentioned, suppresses zinc levels, and zinc's so important for modulating hormones. Copper is essential for angiogenesis. So you cannot have growth of new blood vessels and tumors unless you have copper present. And Dr. Dwight McKee may share with you that he's had, at least 14 patients, stage 4, where there was no visible tumor on PET scan, but yet you knew those micrometastatic cells were out there. He would deplete their copper levels with an oral chelating agent. And if you could maintain that for 2 or 3 years, then the tumor cells lose the ability to grow new blood vessels, and they can go into permanent remission. So be sure to ask Dr. McKee about that, and he can give you more details if you would like. But we want
go into that, yeah,
really low, and we want zinc levels at the very upper end of the normal range. D-dimer and fibrinogen are both clotting and inflammatory markers, so we want those as close to normal as possible. Now, if D-dimer is elevated but fibrinogen is really low, then that may be just inflammation rather than clotting as the issue. But inflammation promotes clotting, so if there's a question, you probably want to, the risk of bleeding, there's always a risk of bleeding with approaches, but the risk of bleeding is much, much, much less than the risk of clotting is in these types of scenarios. And if you bleed, you can always get transfusions. But if you have a massive stroke on one side, if you live right next to a hospital, you may be okay. But otherwise, you may be stuck with that massive stroke, or you may be dead with a heart attack. By the way, vitamin D lowers fibrinogen levels, and a simple treatment with that. LDH is a measure of lactic acid. And I mentioned that tumors produce lactic acid, tearing down the support structures, allowing them to be more invasive. So we want to keep acidity minimized, and LDH is one way to monitor that. Another way to monitor that is to check urine specimens, like the second urine specimen of the day, targeting a pH of 7.0 to 7.5. And if it's more acidic than that, then you can use like potassium bicarbonate to help neutralize the pH in that scenario. But that's important to mark. And then most cancers I mentioned have HER2/neu. So yeah, in the appropriate cancers, you want to be checking that certainly initially, even if you have a breast cancer that's quote unquote HER2/neu negative. The first direction that an estrogen receptor positive tumor mutates to is going to be HER2/neu. Now, it doesn't always go that direction, but the odds are that it's going to go to HER2/neu before it goes any other direction. If you're monitoring HER2/neu levels, initially monthly and on a regular basis, you can pick up on that early. And again, there are natural strategies, and the most important natural strategy, peacefulness. My mentor, Donnie Yance, had a patient who's with breast cancer, and they were having problems at home. Her HER2/neu level jumped up. She did a 3-day silent retreat. That HER2/neu level came right back down. And so a prescription drug that's helpful for HER2/neu is propranolol. Remember I mentioned that drug earlier, right? So in those rats where they promoted, implanted breast tumors and then stressed them out, propranolol was the drug that protected against metastasis. So with HER2/neu, it's especially prone to metastasis if you have HER2/neu issues. So propranolol in those scenarios can help. And so I have a breast cancer patient who is really strongly estrogen dominant. I mean, she has a very powerful on switch, poor off switch. So the propranolol cooled her down nicely, dropped her HER2/neu level very nicely. And you can use very small doses of propranolol, maybe 10 milligrams 3 times a day, 4 times a day may be sufficient, or 20 milligrams twice a day with propranolol can help with that. In hematologic tumors like leukemias, lymphomas, and so forth. The beta-2 microglobulin is a good marker to look at. And then every 3 months, if you monitor hemoglobin A1C, because the tumors love sugar, and so I target 5.0 to 5.2 on hemoglobin A1C. That's kind of 3-month marker on how your blood sugar status is doing. You may want to monitor lipid status, because if your patient's having really high triglycerides and cholesterol, guess what? They're probably not complying with your nutritional recommendations. So that's a way to see how much urging you need to give to your patients with that. And so monitoring vitamin D, and ideally the 125 vitamin D hydroxy as well, is important. And I mentioned Ron earlier with prostate cancer. Look at estrone sulfate. So there are 3 estrogens, right? There's estrone, which is the most aggressive one because it's the alpha receptors. Those are the ones on the sex organs, right? And then there are estrogen beta receptors. Those are the ones on breast and bone. So estrone goes particularly after those alpha receptors. So it especially promotes cancer activity. And the sulfate's the storage form of that. So it gives you a more accurate reading with that. So I've started monitoring that in cancer patients. And then I started monitoring that in my healthy patients as a screening test to see who's at risk for estrogen-related cancers. But you want to keep that level, in a postmenopausal woman, I'd want estrone sulfate less than 30. In a premenopausal woman, you'd want estrone sulfate not any higher than double the estradiol level. Estradiol is kind of the standard estrogen, so to speak. Homocysteine is a toxin and also a risk factor for toxicity. So it's worthwhile, but you need to be cautious how you treat that, because tumors can hijack B12 and folate towards their own purposes. So I would not, just automatically throw folate and B12. Now, some people need B12. We don't want dementia from B12 deficiency. In that scenario, I use a product that has cruciferous vegetable derivatives in combination with a little bit of B12 and folate to help protect against that. But homocysteine is influenced on one hand by the amount of animal products you consume. And then on the other hand, it's a measurement of your methylating nutrients, folate, B12, and B6. Remember, P5P, the dream vitamin, that's one of the ones that's key for lowering homocysteine. And vitamin B2, we haven't mentioned, but B2 helps modulate hormones just like zinc does. So boosts testosterone, blocks estrogen dehydrogenase. So it's okay to give a little B2 if need be, but be cautious about other B vitamins. Some of them are neutral, but B1, you have to be very cautious about. So do not give a B complex. And I don't even recommend a multivitamin for that same reason. But if someone is clearly undernourished, then you can. There's a product, a multivitamin product that's very comprehensive, that's normally dosed 3 a day. So I give just 1 a day. You never want to give a multivitamin with copper or with iron in it. And there are companies that specialize in products without copper and iron in those.
By the way, Dr. Roach, just to let you
Yes.
know, we're not brand or specific product name averse on this event. I think, people people going through cancer just want to know what the experts use. So yeah, feel free to
fine to go ahead and name names.
Yeah,
so I was mentioning a product with B12 folate with cruciferous vegetables, Cell Guardian is that product. It's from Natura Health Products. Most of the products I use are from Natura because they're specifically oriented towards tumor issues. And so that's one that particularly with estrogen-related tumors you can use when B12 and folate are needed. Otherwise, I might use triple cruciferous from Life Extension because it's just purely cruciferous derivatives without the B12 and folate. So when that's not an issue, that would be a good alternative consideration for you. So with peacefulness, inositol IP6, another good thing for peacefulness, L-theanine, that's amino acid in green tea, has a lot of demonstrated anti-tumor activities. A lot of our patients like that L-theanine and potentially magnesium taurate if necessary. We want our patients to have 2 to 3 bowel movements a day because it's a way to get rid of toxins and a way to get rid of estrogen metabolites, because estrogen metabolized in the liver travels down the bile duct and is excreted through intestinal tract. So if you're constipated, you reabsorb and recycle that estrogen. That's not good news. So fish oil, systemic enzymes, aspirin are some of the things that help on the circulatory front. On the immune front, turmeric, quercetin, milk thistle, feverfew, P5P, berberine are some of the things that can help there. So I'm going to move into peacefulness in a little bit more detail. There's so many things you can do to promote peacefulness. But number one, get spiritually grounded. Read about, if you don't believe in a higher power, read about near-death experiences. And if you're open to that possibility, you can become 100% certain. In medical school, they tried to beat that out of you. What you couldn't touch, hear, feel must not exist. And so it's especially difficult for healthcare practitioners sometimes to connect into a higher power. But once not only have I had 71 patients with spiritual near-death experiences, I've had 500 patients with premonitions, intuitions, out-of-body experiences, voices, visions, dreams with meaning. Wow. Those stories are so exciting to hear. And I've gotten to the point where I can identify within 15 to 30 seconds when I walk into a room to a new patient who's likely to have those stories, because it's the estrogen dominant people. It's those ones with a really strong on switch and the poor off switch. Those are the ones that have those intuitive capacities. Those are the ones that have the spiritual connection. Some of those have known about a higher power, about God, since the moment they were born with that. So if they have a higher pitched voice, right, they're more estrogen dominant. They're more apt to have stories that they can share with, but they have to trust you before they'll share those stories with you. But that helps make healthcare fun. When you interact with patients, when they share, we know intuitions are true, but mother's intuition, most mothers, if their child's the other side of the world, it doesn't matter. If their child's getting into trouble, those mothers know instantly. They're on their phone calling. If you ask most mothers, they know when their kids are having problems. That's mother's intuition. How do you explain that? It's quantum physics. It's what Einstein was teaching with that. So we need to get in a peaceful state, addressing the sympathetic nervous system, addressing stress. So, cancer may be a wake-up call. You've been doing this job, you've hated your job. The cancer's telling you, quit that job, get back on your spiritual pathway, doing what you love to do that makes the world better, that keeps the roof over your head. That's what you're supposed to be doing with your life, and not a stressful job around negative energy people, right? Reinvent yourself in this process. Lymphatics is really important as well. There are a lot of strategies for that. There's Tai Chi, Qigong, there's Reiki. There's so many ways to get in a peaceful state that you can utilize. And certainly you want to optimize mood because depression and alienation, wow, those are huge things in terms of promoting cancer activity. I think you can define depression in a way as kind of separation from God, not being able to connect into God. So there are a lot of healthy strategies that can be utilized to get your mood better, but certainly connecting in with positive energy, spiritual individuals is important. If you're depressed, if you're isolated, we all need people in our lives. Because when your adrenaline kicks in, your catecholamines kick in, your heart rate goes up, blood pressure goes up, heart arrhythmias, you can have a heart attack, insomnia with that, you raise your blood sugar when you're in fight or flight, trying to escape the saber-toothed tiger, your clotting factors actually increase, because when that saber-toothed tiger claws you, right, you don't want to bleed to death. So if your blood's thick, that protects you against bleeding in that scenario. And when your cortisol is kicking in, when you're stressed, that suppresses your immune system, suppresses your hormones, increases your risk for infection and for being depressed with that. And, your vital organs are spared, but the liver is compromised and kidney blood flow is compromised. So your ability to detoxify is going to be compromised when you're under stress. And so stress promotes proliferation, metastasis, adhesion of tumors, and tumor cell survivor angiogenesis as well. Also, your immune system in the intestinal tract is IgA. We want to optimize IgA, and again, stress addresses that. So everything we can do to fix so-called leaky gut would help. In breast cancer, stress, like a severe life event, has been associated with a ninefold greater risk of recurrence with that. Relaxing strategies reduce recurrence 45%. Heart math, another strategy that may be helpful, meditation, guided imagery, progressive muscle relaxation, or other strategies that can help. Massage, improve natural killer cells. For example, journaling, it can be helpful. Music therapy, and imagery therapy, laughter, hypnosis, watching a funny movie, all of these things are helpful. Art, hobbies, writing letters.
Sitting outside with the birds.
See, yeah, so I spend a lot of time on my back porch as I'm doing now, listening to the birds. And, I have a mole, that I watch, a baby mole that comes out periodically above ground here. And I have so many animals that come and visit my backyard. It's so healing to do that. But, you can heal in the energetic realm as well. So it's important to realize again about quantum physics and how that you can use energy medicine to heal. There are a couple of great books that I can recommend. One's called Break the Chains by Dr. Jay Roberts. Another, Dying to Be Me by Anita Morigiani, is one probably many of you are familiar with. But you can get prayer warriors on your side, and it's not going to always work. It may not work most of the time, but there certainly are scenarios that I'm thoroughly convinced where prayer warriors have helped patients to heal. So, open your mind to that possibility. Read those books that'll help convince you about that possibility. Get to bed promptly. Get to bed by 9, no later than 10 o'clock, and get up early and try to be regular with that. I do the 5 rites every morning. The book Ancient Secret of Fountain of Youth are 5 yoga type exercises that you can do to kind of get the lymphatics flowing in your system. By the way, Annie Brandt has a terrific book, The Healing Platform. Annie Brandt, as many of you know, I was diagnosed with breast cancer metastatic to the brain back in 2001, and she is healed from that and has annual conferences. I don't agree with everything in the book, the botanical advice I have questions about, but Annie very spunky and has terrific advice in most other areas of the book. So I certainly can endorse that. I've met Annie and she's a terrific individual.
Been to a couple of those conferences myself. They're quite good. Yeah.
Yeah, right. Kind of going through my slides as I talk here, so kind of bear with me with that. Religious service attendance has been associated with improved outcomes. So, but it doesn't have to be formal relations. And even there was a study done, I found this fascinating, where they prayed for seeds in terms of germination of seeds. And there was directed prayer and non-directed prayer. So directed prayer was saying seeds, be sure to germinate quickly and blah, blah, blah. Non-directed would be, if it's in the universe's best interest that these seeds germinate promptly, accomplish that, please. And the non-directed prayer won out in that race in promoting seeds. So fascinating research with that. Healing touch, another good thing to do. And I like Annie Brandt's comment about what she calls the cancer dance, which means, if you dance with cancer, take the lead. So don't wait for the cancer to act and then you react. Take the lead in the situation, do the, and then, in a lot of ways, cancer is like a chess match. So waiting for the cancer to move, it's better for you to take the first move and let the cancer react and you take the next move. But if you do it appropriately, and then you can live a long time just by playing chess in that way. But remember, that the downside is that you may get to graduate prematurely, right? And a lot of these patients maybe have had traumatic events in their life. They might have had kids that died prematurely. And teaching them that those kids are doing fine. Their spirit's on the other side, and again, that's connecting in spiritually. And if you don't understand that concept, explore, research, and teach your patients that their loved ones are fine on the other side of the veil. Music's wonderful. I like to play. I play a lot of 60s music, and I love that particularly. The Beatles, I've been listening to a lot lately. So I've talked about botanicals that are calming, relaxing, inositol IP6, P5P, chamomile tea, L-theanine, magnolia with hanakau are good, and prescription propranolol. Rhodiola is particularly good for cancer fatigue. It hits VEGF, that is, it blocks angiogenesis with that. Ashwagandha, I think it depends on the tumor. I don't like to use ashwagandha in breast cancer because it is a little bit androgenic, and half of breast tumors can have androgen receptors. But with ovarian endometrial cancer, I think ashwagandha has some positive research. Ashwagandha is one that oncologists and radiation doctors have a much higher comfort level with. It gives you 12 hours of GABA calm and peacefulness associated with that. And, there's research behind these. So I will have a slide series that will you should have access to that will have a lot of the research listed in terms of what we've been talking about.
Yeah, just FYI, everybody, there's Dr. Roach is hitting an impressive number of the slides that he sent me, but not all of them. So that yeah, will be available definitely.
Okay. So I'm going through my circulation test. Let me just mention the last thing or two with circulation. So I mentioned D-dimer, and if it's above 2, I'm going to recommend Lovenox from here forward. If your D-dimer is less than 0.5, I still want to be doing prophylactically some circulation promoting nutrients. So fish oil falls in that category. I use a product called Botanical Treasures that has turmeric, resveratrol, green tea, and bromelain. Bromelain, remember, given on an empty stomach, gets in the bloodstream, has a blood thinning effect with it. And Flamaway is another product that's kind of boswellia frankincense with feverfew, hanukkah, magnolia in there, and bromelain. Quercetin Plus is a product that's quercetin with bromelain in it. And for vitamin D, I use a product called Vitamin DAK, and these are Natura Health products. It has these. The DAK is 5,000 of D with some vitamin K2 and a natural source on vitamin A. Whenever you give vitamin D, always give K2 with that. With vitamin D, I've done over 2,000 blood levels, found 1,000 units per 30 pounds is a maintenance dose for 95% of my patients. Now, there are exceptions. If you have sarcoidosis, if you have acute leukemia, acute lymphoma, you need to limit vitamin D to like 1,500 units to 2,000 units. You can get in hypercalcemia, that is high calcium, if you have acute leukemia lymphoma, which can be life-threatening. So you do need to be cautious. And there are few, I did have one melanoma patient who developed high vitamin D from 5,000 units, but 95% do well. So I'd start on an aggressive dose, but quickly recheck a vitamin D level to be sure you're in the right place. But if you give vitamin D without vitamin K, you're going to suppress vitamin K, you're going to calcify the arteries, and you're going to weaken bones, make them more prone to metastasis. So you always need some vitamin K2 in with that. And it's not going to thicken the blood unnecessarily. It promotes normal coagulation, but only thickens the blood if you're on Coumadin or if you have a vitamin K deficiency. It actually protects against heart attacks, research suggests, and promotes brain stem cell growth. But if you get too smart, you can cut back on the dose of your vitamin K. If your D-dimer runs between 0.5 and 1, then I may use some extra bromelain, either products that have bromelain in them or actual bromelain pills you can add in to strive to get D-dimer back to normal. If the D-dimer is between 1.0 and 1.5, then Baluchi, which is derived from earthworms, is what I use in those scenarios. I use one twice a day. So it's at least 5 or 10 times potentially more potent than bromelain in terms of its circulating promotion effects. And if D-dimer is 1.5 to 2.0, I might use 2 Baluchi twice a day or even possibly every 8 hours because it mostly is worn off after about 8 hours with that. So that's how I manage D-dimer levels and coagulation issues. But there are other things. I use a product called Nutrizymes. I think it's from American Nutraceuticals that also has venous flytrap in it. They're little small tablets, so you can give anywhere from 5 to 20 tablets. That sounds like a lot, but these aren't very big. I can swallow 20 of these all in one swallow, believe it or not. And you could give that every 8 hours. Cayenne is another nutrient that really promotes circulation perfusion into tumor areas. Okay. So copper and zinc we kind of talked about, C-reactive protein. There are a lot of, turmeric, ginger, many botanicals that help dampen inflammation. The boswellia frankincense, another one in that category. And I'm just kind of going through blood tests real quickly. Galectin-3 is another one to keep in mind. Now, insurance doesn't always cover that. Now, all of the tests that I've mentioned up to this point are covered by insurance. If you code those correctly, and generally just cancer is all you need to most of the time to code for that. So these are tests that any healthcare practitioner can do. You still might have copays with that, but these aren't costly tests because they're covered by insurance. But galactin-3 has not been covered, and so it can get a little pricey, but that measures kind of the lectin levels, and the higher the lectin levels are in the bloodstream, the greater the risk for metastases. And there's a product out on the market, modified citrus pectin, PECTIN, that can help bind up the lectins, protect against metastasis in those scenarios. But you probably would want to give that separate from other supplements to keep that from interfering. Okay. And I check, again, estrone sulfate level initially where I suspect estrogen is a factor. And when it's abnormal, I check it. Though if you're on aromatase blocking drug, I find that the blood levels are not accurate in that scenario. And of course, there are other specific markers you can look at, CA19-9 in pancreatic cancer, of course, PSA in prostate cancer, CEA in colon cancer, and so forth, that can be helpful. So for your immune system, a lot of things you can do, lots and lots of research. Okay, doctors may say, well, there's no research. Well, that's because they haven't looked. If you look, it's interesting, you will find that lots and lots and lots of research. You know, turmeric has 100 identified anti-tumor markers associated with it. And what does turmeric do? It lowers blood pressure, blood sugar, blood cholesterol, thins the blood, anti-inflammatory, gets toxins out of your system, prevents gallstones, antibacterial, antifungal, antiviral, antidepressant, equivalent to Prozac. There's not a cancer patient that hasn't had improved outcome with turmeric. Dr. Agarwal discovered that when his research down at MD Anderson. And then turmeric grows the brain by two different mechanisms. Curcumin, 90 milligrams twice a day over 18 months, boosts memory 38%. And turmerone, which is not in curcumin, but in turmeric, boosts brain stem cell growth up to 80%. So again, this is one of the things that can make you smarter by taking turmeric. I want all of my patients on turmeric every day. And if it happens to cure your tumor, that's nice as well. And there's a radio host. I was on a radio show just last week. His wife had glioblastoma, and he was told to put her on really high doses of turmeric. I think it was like 10 grams of turmeric a day, and then gradually taper down on that. And he said when they did a scan of her brain, when she had a stroke 6 months later, that the glioblastoma was gone, and he credited the turmeric. Wow, that's hard for me to believe, but you know, each tumor is a little bit different, and turmeric's not going to cure most glioblastomas or even a third or quarter of those. But if it cures 1 in 100 or 1 in 1,000, then wow, how impressive that would be. But we want all of our tumor patients on that. I want all my tumor patients on Nostal IP6. I want them on all to get vitamin D in appropriate doses, P5P. I want them all dreaming every night, and that helps them rest better at night. Many of them benefit from melatonin. If they're sleeping well, they may not have to have melatonin. But if they have any sleep issues, certainly would try that. And then with estrogen-related tumors like breast cancer, sometimes you can go through real high doses like 20 milligrams fish oil. I think all of our patients, that helps with circulation, that helps with anxiety, it's anti-inflammatory, and there are many others beyond that, all that have plenty of research to make you comfortable with that. So you'll get the benefit of, on the slideshow, when you get a copy of that, it'll have a lot of that listed. So I'm finally about at the end of the talk. The last one or two things I'll mention. Number one, artemisia. And resistant tumors, I frequently use a product that has artemisinin in it. Again, I use a product through Donnie Yance for that purpose. I do it 1 week on, 1 week off, specific protocol.
And that's the Natura Health products?
Yeah, right. And what that does, it actually is cytotoxic. So it follows iron into cells. Tumors take up iron disproportionately. They love iron. So they soak up that iron. Artemisinin follows iron into the cells, and the artemisinin kills the cells, the tumor cells. Now, healthy cells that take up iron also may get killed, but tumor cells may take up iron 10 times more than the healthy cells. So it is like what I call an herbal chemo in its effects. But most of the time, in more rapidly growing tumors, hot tumors, most of the time that I find that's helpful for getting things under control with that. And I wanted to mention about P glycoproteins as the very last thing in my presentation, because I have access to a product. This company that makes this product does not want it promoted. at this time, and the reasons, appropriate reasons for that. So only our office and an office out in Arizona and maybe possibly one or two other places have access to this particular product. But it has a botanical ingredient that it has a it's very powerful P-glycoprotein inhibitor. And so when you get chemotherapy and have this on board, that inhibits tumor cells being able to get rid of chemotherapy, so it makes chemotherapy more effective. And with artemisinin, clinically, what I find is inhibits the ability for the tumor cell to get rid of artemisinin, so you can get potentially a higher kill rate. And so I've seen some impressive responses to that. One of my good friends had a patient with end-stage hematologic cancer, and the very last thing they gave was this JAK2 inhibitor drug, but it wasn't working until they gave it in combination with this P-glycoprotein product. And that and she had 3, 4, 5 years of remission with that before the tumor finally came back, just with that type of product. So that's a special thing. If you have a conference, you're welcome to consider coming, and I can give you more details. But the company won't let me give you. It's not that I'm trying to. People, there are natural things, though. They're P-glycoprotein inhibitors. So tirostilbene, which is in blueberries, is in that category. Not as potent, I think, as this one. Silymarin, which is from milk thistle. Piperine, which is pepper, is a P-glycoprotein inhibitor. Panax ginseng, resveratrol, even the artemisinin that we talked about, Corydalis, astragalus, and then even red clover and ginseng. So those are other ones that can help somewhat by that mechanism. But a real fascinating approach that can maybe give additional benefit to patients. So you're welcome to, I'll have other gifts available to you as well. I'll be happy to share if your audience is interested, what I recommend in combination with checkpoint immunotherapy drugs. I'll be happy, if you want me to share the first chapter of my book for patients. And I would encourage patients to consider a newsletter that can provide a lot of information. So those are some things that I can offer. So you're welcome to come to Horse Country, Central Kentucky. I'll be happy to give you some ideas. Remember, though, you may not always be cured, but you can always be healed. And ultimately, that's all that it matters. Whether you live one day or whether you live decades, if you're going to be in ultimate bliss, there's nothing better than ultimate bliss. My near-death patients have convinced me. And so, Neil, Ryan, it's been very blissful getting to talk with you. This is my spiritual mission, to educate in this way, and you've given me a venue to do that. So I appreciate that so much.
Well, you seem to be right in alignment with your with your spiritual mission, Dr. Roach. It's it's should we all be so lucky? I think I'm on my way there, but you got a couple of years on me, and you've certainly taken what you're supposed to be doing here and taken action in the world and done it. And wow, that was a masterful presentation. I would I have some Q&A questions written down, but that was so comprehensive that I think we'll probably just go ahead and cut it there.
Sure.
With the exception of thanking you for the Lovenox tidbit in there. My son he had a clot and he had to be on Lovenox, and it got discovered a while later that they had kept him on a therapeutic dose versus a prophylactic dose for far longer than they should have. And I was always really, really upset about that. And it's stuck with me to this day that I should have caught that earlier and gotten him off of that. And you kind of made my day with that. So
it made that a God thing, right? That he was stuck on that Lovenox accidentally, that may have promoted his healing more rapidly.
Yeah. Very good. Well, I would one, just again reiterate for folks that the slides, especially towards the end there was a lot of research on a lot of these different compounds and a lot of compounds in general that didn't even get mentioned or addressed to their fullness. So definitely check out the slides for that. And I ashamed that I'm not already on your newsletter, Dr. Roach, but I'm going to remedy that right after we get off the call here. And lots of good stuff that you've given. Thanks again for the bonus to this event for the cancer stem cell anti-CSC nutrients, I should say. Yeah, one more time, vitalstrategiesandcancer.com would be the place for the book. And anything else you want to reiterate about where to follow up with you, find you, anything you're working on, anything like that? I want to make sure that's
so yeah, if you know the God's house calls, if you don't believe in that higher power and you're open to that possibility, you read that book, you'll be very entertained and enlightened by that. You know, there on YouTube there are so many different YouTube stories on near-death experiences. So convince yourself. You know, it's hard for guys. It's estrogen related. The higher estrogen, the easier it's to connect in. But if you're a guy, yeah, you're not sure about that. Become sure about that. It changes your life when you do become sure about that.
Very good. That was Dr. Jim Roach. Everyone, I am Ryan Sternagel of the Stern Method, and we'll see you on the next one.
And again, this was one of many amazing talks from our Anti-Cancer Revolution online conference series. If you would like the entire first and second events, along with detailed notes from the talks, together with the actual slides from the presentations, and most importantly, the ability to ask these doctors and healers anything you want yourself directly, that's what you get with Going Integrative Plus. This is the resource and community my wife and I would have given anything for when we were going through cancer with our son. Each and every week we get one of the top integrative and holistic cancer doctors in the world on a call, and you get to ask them literally anything you want yourself. Listening to this podcast for your health is amazing, but getting to be the one asking the questions yourself about whatever you're currently trying to figure out dramatically shortcuts the learning curve and helps you make more right decisions faster and avoid the wrong ones. You also get every past call we've ever done, which is hundreds of hours of content that's all transcribed, time-stamped, and searchable, so you can see what all of our experts have said about any particular topic, which is a very nice antidote to how hard it's become to find good natural health information pertaining to cancer online these days. Huge discounts on all of our favorite supplements and devices, and maybe most importantly, a great community of people who are all on the same page with holistic healing. It is the absolute most valuable thing for someone serious about either preventing or reversing cancer we could imagine, which is why we made it. You can check it all out and become a part of it at goingintegrativeplus.com if you feel like this would be a helpful thing for you. And as always, remember, if you are going through cancer or anything else you'd rather not be, just keep going. God bless and Godspeed, and we'll see you on the next one.